Hello, how are you? My name is Natalia Munoz and I'm an occupational therapy student. And today we're going to discuss what we learned this week, which is how to perform an evaluation on a patient that has suffered a stroke and what are the community resources that can be provided for them. So this week the video was about a clinician completing an evaluation on a patient with a stroke. He assessed range of motion, manual muscle test. He assessed sensation on both sides of her body, sitting balance, dynamic sitting balance, like reaching out of her base of support, and how well was she able to transfer from her bed to another stretcher. It was a very interesting evaluation, and it was really good to see the clinician was a physical therapist, but still, as an occupational therapist, I need to learn how to do range of motion, manual muscle test, sensation, and I also need to know how well does the patient tolerate sitting at the edge of bed, standing up, because, for instance, to complete dressing, they can be sitting at the edge of the bed, and if the patient cannot tolerate that, then that's a concern. So it was very thorough. The clinician was very kind, was very patient. He explained himself very well, and something very important that he used common terminology. He didn't use big medical words, and I think that that's very important because it helps the client feel more comfortable and not so nervous. And also, he was very friendly but respectful. He made the client feel comfortable. She felt that she was engaged and she was taken into consideration because he engaged her. He asked her questions. He always asked permission if he could sit on the bed to complete a test, an assessment. When they were going to stand up, he had to sit next to her to fix her robe, and he asked her if that was okay. So it's very important because even though we're clinicians, we don't want to invade the personal space of the patient. They're still patients, and they still feel their emotions, and they feel threatened by a stranger coming in to touch them and move them and tell them do this, do that. So bedside manners are very, very important, I think. Now, another thing that we discussed this week was community resources. Why is it so important for us to understand what are the community resources for a patient that is being discharged from a hospital? Well, sometimes they need to go to a nursing home, or they're going to go home, but they need care. They still need a home health aide. They still need physical therapy, occupational therapy, speech therapist. So the families and the clients don't know what's going to happen after that. Think about it. You have a stroke, your life changed completely. So now you're being sent home or to a skilled nursing facility, and you don't understand what's happening, what's going to be the next step. So by providing community resource information to the families, you can help ease that transition. You can guide them to what are the next steps. Where can the client go if they want to go to a nursing home, or if they can get home health assistance so that they can stay home with their families and not go into a different place. However, they can still receive those rehabilitative services at home. Also, there's some patients that the effects of the stroke are not so limiting, so they can still participate in the community, and they can go to an adult daycare center, and they can receive therapy services. They can participate in leisure activities. Try to normalize their lives as much as possible so that they feel that they are still independent, they still enjoy and find meaning in life. And it's a process, but we're there for them to help them find those resources. Now, if I had to choose an assessment that I observed that I liked, I have to say that the orientation, the way that the clinician addressed the cognitive aspect of the client was very interesting, because he didn't really complete a full question as to address cognitive section step by step. he established a conversation, a very normal and typical conversation. How are you today? Where are you? Do you know what happened? So you're trying to get information from the patient, and it's going to help you determine how much cognitive deficits the patient has. So it was very interesting. It was obviously, as a student, you learn it the way it is on the paper, but the more you practice, it becomes more natural. And I really like that part. Now, an assessment that it was, I liked it a lot, but I thought it was very thorough, and I don't know how to use it yet, is the sensory one, because you need to understand how much pressure you're putting, how much sensory input you're providing on both sides. Are you doing both sides of the body? And for the patient, she had no sensation on her right side, but she had movement. Some of them were uncontrolled movements, but she was able to reach with her hand. She was able to lift up her knee while she was sitting, but she wasn't aware. There was no feedback from her body when she was moving. So it's a very interesting assessment, and I think I would like to have more practice doing it. And then now there was another question that was, what would I do if my findings were different from the physical therapist evaluation findings? Well, I think that the most important thing to do is talk to the physical therapist, because there are many factors that can affect the results on an assessment. For instance, at what time of the day was the evaluation done? Some patients don't have the same level of energy in the morning as they do in the afternoon. And if you go in and the patient is tired, then that could affect their performance. If there were any medicines that were provided to the client before you completed the assessment, that can also create a difference, because if there's side effects and the patient is under the influence of the medication, is going to compromise the way they perform. Also, for instance, a manual muscle test, if the physical therapist is a tall person, strong person, and here I am, I'm 5'1" and the level of manual muscle resistance that I have to provide might be different than the one that the physical therapist provided. Now, if it's a big difference, you want to communicate why was that? What was the position in which the patient was doing, or laying down or sitting down when the manual muscle test was done? And also practice. Sometimes as a new grad, you're nervous and you might have missed something, or you might have done something different than the way the physical therapist did it, or the other way around. So it's always important to have good communication with the other clinicians and discuss what the findings were, and maybe you can reassess together at a later time so that you can come to a conclusion as to what was the most accurate results. All right, thank you for joining me, and have a great day.